Welcome to Gout, Nursing Mastery. This video provides comprehensive nursing mastery for competitive exams, focusing on key knowledge points about gout. Let's start with our first question. Gout is primarily caused by the accumulation of which substance in the joint? The answer is uric acid, specifically monosodium urate crystals. Gout is a metabolic disorder characterized by hyperuricemia, where these crystals deposit in joints and tissues, triggering an inflammatory response. Next question. Podagra refers to acute gouty arthritis involving which joint? The correct answer is the first metatarsophalangeal, MTP joint. Podagra is the classic clinical term for acute gout attacking the base of the big toe, which is the most common site. Which drug is the first choice for an acute gout attack? NSAIDs, such as indomethacin, are the first-line treatment for acute flares to reduce inflammation and pain. Allopurinol is for chronic management and can worsen acute flares if started during the attack. Which drug works by inhibiting the migration of neutrophils to the site of inflammation in gout? The answer is colchicine. It is specific for acute gout flares. It reduces the inflammatory response by inhibiting neutrophil migration and activation in response to urate crystals. Allopurinol is used to prevent gout attacks by what action? The correct answer is inhibiting xanthine oxidase. Allopurinol is a xanthine oxidase inhibitor, which reduces the production of uric acid, making it ideal for chronic tophaceous gout management. Which food is highest in purines and should be avoided in gout? Organ meats, such as liver and kidneys, are highest in purines. The body metabolizes these purines into uric acid, exacerbating hyperuricemia. What are tophi in chronic gout? Tophi are deposits of monosodium urate crystals. These hard, irregular, painless, or painful nodules accumulate in soft tissues, often seen in chronic gout. Now, which diuretic class can precipitate a gout attack? The answer is thiazide diuretics. Thiazides reduce uric acid excretion by the kidneys, significantly increasing serum uric acid levels and triggering gout flares. Moving on, which is the gold standard diagnostic test for gout? Joint aspiration, or arthrocentesis, is the gold standard. Identifying needle-shaped, negatively birefringent urate crystals in synovial fluid confirms the diagnosis. Aspirin should be avoided in gout because aspirin increases uric acid retention. Even in low doses, aspirin impairs the kidney's ability to excrete uric acid, potentially worsening hyperuricemia and gout. Which phase of gout is characterized by normal serum uric acid but painful flares? The answer is acute gouty arthritis. While serum uric acid is high during the initial asymptomatic phase, levels can normalize during an acute flare, as the uric acid shifts into the joint. What is the fluid intake recommendation for gout patients? Patients are recommended to consume 2 to 3 liters of fluid per day. High fluid intake promotes uric acid excretion and helps prevent the formation of renal stones, a common complication. Pseudogout is caused by the deposition of. The correct answer is calcium pyrophosphate dihydrate, or CPPD. This condition mimics gout, but involves different crystals and often affects larger joints. Which of the following is a key complication of gout? Chronic kidney disease and renal stones are key complications. High uric acid levels can damage the kidneys and contribute to uric acid stone formation. Finally, probenecid acts as the answer is uricosuric agent. Probenecid works by inhibiting the reabsorption of uric acid in the renal tubules, thereby increasing its excretion. Which population is most commonly affected by gout? Middle-aged to older males are most commonly affected. Men typically have higher uric acid levels, and the incidence increases with age. During an acute gout attack, the affected joint should be immobilized and elevated. This helps reduce inflammation, relieve pain, and limit further crystal irritation. What is the goal of febuxostat? Febuxostat's goal is to decrease serum uric acid production. Similar to allopurinol, it is a xanthine oxidase inhibitor used for chronic management. What effect does alcohol consumption have on gout? Alcohol consumption increases uric acid production and interferes with its excretion. Beer and spirits, in particular, increase the risk of gout attacks. Tophi most commonly develop in which stage of gout? Tophi develop in the chronic tophaceous stage. This is the advanced stage characterized by persistent hyperuricemia and crystal deposits in joints and tissues. Which of these should be encouraged to alkalize the urine? Citrus fruits or bicarbonate help to alkalize the urine. Alkaline urine promotes the dissolution and excretion of uric acid, reducing the risk of renal stones. Which laboratory finding supports the diagnosis of gout? An elevated serum uric acid level is characteristic. Although levels may drop during an acute flare, hyperuricemia is the underlying physiological mechanism of gout.